aim, most importantly, they produce predictable anticoagulant response. Nope. Dental patients who take them have frequently seen. No. Do you know what this is? If you would have to tell me what type of text is this of all the ones which I mentioned, which should appear or not? Do you have any idea? It should be the aim and the summary of the results. Is it? Short yes or no will suffice. Either nobody is listening to me, or you don't know, or you don't want to write. Anyway, it's not, obviously, I hope, obviously. It's background. All of this is background. So it could have a place in the introduction, or if there are background chapters, in the background chapters, not in the discussion. Sometimes it's helpful to continue a certain flow, to use one or two background sentences, just to transfer into the next topic. Definitely not 3 paragraphs and not at the beginning of the discussion. That's not what you're expecting there. So that's summarized in here. Should be there and is there. Nothing really at this point. Should be there and is not there. Yeah, that should be in the green part, the aim and the findings. And should not be there and is there, the background. Not here. So let's take the next step about the findings. You know why I didn't do the correction right now, but after this step. So that should give the meaning of the findings put into the literature context. So these are the next 3 paragraphs. And the first one says, to date, few studies investigated dental management, and some authors supported withholding the NOAC dose before surgery. That is not background. That's not an aim either. What this is actually the beginning of, well, not exactly interpretation, but maybe literature context to a certain degree. Next paragraph, the thesis aims to justify risk. That is the aim of the thesis. And that should be at the very beginning. And next, dental procedures are considered to confer low risk, can be continued. NOAC can be continued in most patients during these That is already a recommendation. It says what should and can be done with the NOACs. So what we have here is the beginning of an interpretation. That should be there, and that's okay. We also, what should be there and is not there, the meaning of the results, the answer to the original research questions, using the results. That's not there. The literature context of these results, also not there. Instead, we have aim and consequences of findings. So, now for the revision of the opening, and now you see why I wanted to talk about the revision of the opening now, not earlier, because here I have the restated aim. And this is the original aim. Now, if you read these two and compare them, you notice they are very similar, but not identical, because in the restated aim, it says it's the main aim to justify implementation of risk reduction strategies, to minimize complications using NOAC during surgical procedures. And here, it says it's the main aim to determine which dosage is best suited to minimize the risk during organ surgery and so on. So they are very similar, but the main focus is different. And that can, of course, be somewhat problematic if you want to write a discussion that actually matches up with your aim and your research questions. And that is an absolute prerequisite. This you have to do. Yeah, I marked that in here. So my take-home message about the opening: take care that your aims match in the beginning and in the end, because sometimes things shift. So check against your aim and your research questions. Now the next part should be the results summary. The main findings, most important findings. Which results should I summarize? I keep telling you, if you write the thesis, use your research questions as a basis. Yes, you should use them, but not all of them. Because basically, you do not summarize background questions. Which NOAC are in use? What are their characteristics? That's a background question. This one, what is the dosage regime? Background question. Background information, I already told you, no place in the discussion. That's further up. So you do not summarize background questions in here. So delete. You also do not summarize the results for discussion questions because they do not have any results. That is what you are addressing in the whole of the discussion to a degree. So this one's the discussion questions. What recommendations can be made for treatment? Yeah, that's the importance. And these are which are most effective, which indications, contraindications, how to manage. Those are also all recommendations. These are all discussion questions. So, and that's the reason why I included the revised questions in here. You do summarize data questions because these give you the data to actually address things. That leaves only these two. So as a reminder, we had this for the revision. We had a little bit of interpretation. We had this, most of it was missing though, and we had some of the aim and the consequences. So to revise, that's the part that sounded like a start for interpretation and literature context. It's not really interpretation or answer to the question because, sorry. Because it doesn't give the question, it doesn't ask the question, and it doesn't give the answer. It just says few studies have investigated the management, and some authors supported withholding the dose. That might be a summary of data that is in the results part, but it's not clear from the way it is written, and it sounds like more of a literature context. Only you don't know for what data, because that isn't mentioned here. Also, it says some authors supported withholding. What did the other authors support? If you write it like that, I mean, that's an obvious question. So how do I really do it? How do I start that? First, like I said, look at the question that asks after data. So which patient and environmental factors maybe have to be taken into account? How do they influence NOAC function? Then check your results. You should have a results chapter for this question. That would be this: factors that affect the function, patient factors. Then we have some interactions with other drugs, interactions with food. So there are subdivisions in here. Now, answer the question using the results you have. For instance, if you look at renal diseases, you say, okay, yes, renal disease does influence the action to such and such a degree. That's the answer you have, that you asked after that, and now you're answering it. Then you can give some more details. Does the severity of the disease play a role? Does the type of NOAC used play a role? Yes, it does, if you remember the table from the last time. Then, literature context. What did others find? For review, not so much what others found, but what others thought. Try to give an explanation, give a recommendation. Sorry. And basically, this one's important. Talk about how to do it in separate parts. I mean, it's one big question, but you remember here from the results index, it's a question with sub-questions, really. So you cannot really answer this question in one big block. It'll be confusing. It'll be much easier if you say, okay, first now I'm going to answer about what patient factors actually influence it. And then I'll look at the interactions with other drugs. I'll answer the question, I'll put it into the literature context, then I look at interactions with food, answer the question, put it into literature context. Because they're too different to do it all at once. And that is the substructure I'm talking about, which is based on your questions and on your result structure. And this is the original version, the original question, management of patients. And these are the results addressing these questions, management of patients. And the problem here is it's a discussion question, basically, or should be, except if you use another approach, if you want to summarize different management methods of patients, but then you have to think of a way to say which is better or which is not. Otherwise, it's just a summary of things. And how do I answer that? What results do I have in answer to these questions that I can easily summarize? Not really. With the other, it's easier. That's why it's important to think about the clarity of your questions and of the data which you need. Now, next, 1, 2, 3 points, consequences of the findings. In the text, there are actually most of the thesis is consequences of the findings. So consequences are definitely there. Actually, it's I think I stuck all of it in here, 2 pages of it. They are there. The clinical implications to a degree, because usually you should say, this is my data. This is answer to my question. Yes, there is an impact of renal disease. And the clinical implication of this fact is that I should check my patients for renal disease and then adjust the dosage accordingly, taking into account the fact that for the different NOACs, for one it is 3 times as high as for the other, something like that. Yes, that is going from your data over the answers to the clinical implications. And here it's just the implications without the starting point. That's kind of missing. That means this is missing, the generalized results, which are actually your starting point from which you deduce the implications or the recommendations. So they're not there. And they should be. So how to write the consequences part? As I said, they have to be based on the answers, the interpretation of your data. And from this, you continue and say, now I found this out, and this means for the patient, for instance,